I'm Dr. Naiken. I'm a surgeon. I'm the head of the surgical faculty and medical director in a hospital in Switzerland. But it's more in my capacity of president of the Humanitarian for Empowerment Foundation that I've been invited to present on how AI can bridge the gap and empower healthcare in underdeveloped and developing countries. So, one of the countries in which we are very active said to me, "Why do you always say underdeveloped countries and developing countries? Probably you should change that to low-income countries." So let it be low-income countries. So just to give you an overview of what Humanitarian for Empowerment is, Humanitarian for Empowerment is a foundation, philanthropic, whereby we want to empower people, where we want to empower structures and governments. And our philosophy is, why give a man a fish when you can teach him how to fish? So empowerment, education is our sole philosophy. We are active in Mauritius. For example, we've just signed with the American College of Surgeons, whereby we show Mauritian doctors, surgeons to operate in laparoscopic surgery. We are active in Kosovo. We are active in Ukraine. And in Ukraine, together with the president of the European Union, Ursula von der Leyen, Mario Draghi, the former Italian Prime Minister, James Sullivan, and Blinken, and so on, we were also, we had the highest recognition, but we remain neutral and apolitical. So, what are the main challenges in low-income countries? We do know that there is a healthcare professional shortage, low human resource. We do know that there are also limited diagnostic tools and equipment which have an impact on the outcome of the patients. We do know that there is also underfunding and outdated technologies. And because of this high cost health system, what happens is people renounces to go to the hospitals. People don't go to their treating doctors because it's far away, because it's very expensive. And adding up to that complexity is that because of inefficient health data system, politicians take wrong decisions because everything is financially dictated. So how can AI help there? So it was very difficult to prepare this presentation because the panel in front of me is not only from the medical world, not only from the philanthropic world, and then to have a presentation outline was very difficult for me. Should I go more on a medical aspect or more on the IT, which is not really my sphere of competence, or on a philanthropic? So I've tried to, get everything summarized in a melting pot, and then at the end, I'll show you what the humanitarian empowerment has done in Canada, in Kosovo, in Madagascar, in Mauritius. So, as I said, the challenges is really under-evaluated in those countries, because according to the World Health Organization, there's a shortfall of 4.3 million of healthcare workers. We do know that there is a big potential with AI, is a big potential by enabling predictive analytics and automating processes. We can talk about imaging, we can talk about laboratory, we can talk about treatment, but the concrete solutions is open source technology which can foster collaboration, and then we should make tailor-made AI application. One does not fit all. What we use in Europe, what we use in Africa won't be the same. We should adapt our tools to the local environment with the reality, financial, cultural, and specific reality of the ground. So we do believe that there's a big gap nowadays between Europe, developed countries, the United States, and low-income countries. And we do believe that this gap there will be a leveling, not to equity, but there will be a leveling in a nearby future. The Humanitarian for Empowerment has focused its aim in Africa because we do believe that Africa will generate one of the biggest migrating crises. And that's why our philosophy is to empower over there so that we can give people the ability to become autonomous. So the current situation, as I said, we have loads of publications. If you go on PubMed, you will see loads of publications using different AI techniques, machine learning, deep learning, natural language processing, large language models. So this is all available in developed countries. While there's a very limited access to healthcare professionals in other countries which do not have the same resources as us. So I won't get back to that. We do know, I've mentioned that before. What are the possibilities? Because this is what interests us. One of the possibilities is an application for predictive analysis for public health, because we have a lack of diagnostic equipment, human resource. One of the AI applications that my colleagues are developing will help predict outbreaks and optimize resource allocation. The Red Cross is already using that in the Israeli-Palestinian conflict to predict the movement of the refugees, to predict the population of the refugees, how many kids, how many children, how many women, and so that they can allocate workforce over there. So, and we have, I've put there an example of the Ebola outbreak, which was being predicted by the AI model. Now, before that, I spoke about politicians. I said that sometimes they are not always being well advised by the advisors or by the policymakers. So one of those reasons because they lack data and they are not connected to the field. And with AI-powered health data analytics, what we are trying to do is to gather healthcare data so that we can go to the politicians and make them change their policy or influence on their policy. Now, lack of diagnostic equipment. You know, I've long time ago worked in a country called Rodrigues Island, where there are approximately 35,000 inhabitants. And there is no CT scan over there. And what happened is the doctors, on a basis of an X-ray, because they are not sure of the diagnosis, they order an air flight so that the patients are being transferred to Mauritius and for a CT scan. Enormous financial costs. But with that same cost, we could have done load better. So what we are working with some technicians, we are trying to get on basic radio some algorithm that will diagnose more precisely, analyzing medical images so that those patients do not have to travel to obtain a better diagnostic investigation. We are also, I'll show you later, we're also doing with pharmaceutics and labs, we are trying to do some algorithm on how AI can help lab technicians without the pathologists, because there's a lack of pathologists in some African countries, so that they have the diagnosis without getting an expert opinion. So the impact should be faster, more accurate diagnosis, reducing medical errors, financial gain, and enhancing treatment outcomes. Now, in Madagascar, for example, with other colleagues, what we did is, because people, it's very far away, and you have to travel long to get to a hospital or to a local health facility. So what we are doing a mobile health platform which does not require internet. We've tried to build up a cloud system. So I'm not an IT, so this is what the technician said. And whereby with the mobile phone there and with a medical personnel, the patient's answers to questions, and with the algorithm, it can produce what are the diagnosis and what should be the treatment. So this is a major advance. And for chronic disease, diabetes, hypertension, hypercholesterolemia, so all this we are trying to do this platform so that those people, they get access, because access to healthcare is important, and so that they don't need to travel, and there's more compliance to their treatment. What we're also trying to do, well, that's not in a low-income country, but in Switzerland, we are trying to make remote patient monitoring. So why? Because we all know in different European countries even, healthcare cost is increasing. And what we want to do is to maintain the patients more at home. And what we are doing now is in a concept of integrated health system, we leave the patient at home, no need to be hospitalized, and then we have distant monitoring, and with AI technology that can streamline with our healthcare workers in the hospitals. Telemedicine, I've spoken about that. We had tried some telemedicine with the Palestinians, but the conditions were not ideal because there was no electricity and it was quite hard. But it's something which in November we'll implement in Madagascar, because we could convince the local government to go forward with that. And having said that, sometimes it's more easy to get things implemented in those countries than even in Switzerland, for example, because you have loads of legal frameworks that thereby you can bypass. So, as I said, there are some loads of literature where you can see that AI can diagnose eye diseases on colonoscopy for our colleagues, gastroenterologists, for virtual colonoscopy, and so on and so forth. But let me get to what we have done. So before getting that. So the aim for me when I accepted to present was saying we have to regroup. We have to work all together, because sometimes there are some startups that comes to us, say, look, we have the money, we have the application, but we can't put it in practice. Can you help us? Can you coordinate to put it into practice in some countries and everything? So that's why, I'm open to any discussion if you want to work together in a win-win situation. At the end of the day, it's for our patients and the populations that should be the winner. So we want to build and develop lightweight AI models like TinyML, Lamal tree, things which can be used modular in different contexts. In Palestine, where there's no electricity and sometimes no internet, where there's slow internet, not like in Europe. So this is what we want to do. Some of our colleagues are now working also on an AI-driven supply chain management, because we know that different audits in all the hospitals, not only in low-income countries, but in all the hospitals, we know that one of the things is that we have stocks and then it gets expired and we have to pay to destroy them. And that costs loads of money. So now we are trying to make, it's called TraçaBlock, and this AI change management will give us an insight about the traceability of things, about how, when does it expire, how much it costs, and so on and so forth. Empowerment, getting back to that. So empowerment is something which is very important, as I said. And AI today, you don't need to make people come from those countries to Europe to get trained. Because what happens is sometimes people come, we see it for doctors and nursing officers from those countries, and they don't go back. And what happens is you've invested in those people, but there's no transmission of know-how. So that is why we want to invest in local talents on the ground for the community. And with the American College of Surgeons, but also with the Pôle Santé WCBLeaders, what we are doing is we are trying to do virtual stimulators. There will be some publication, I think, from Stanford and from the American College of Surgeons, whereby they've collected data from surgeons with different sensors and everything to know what is predicting the movement of the surgeons for specific intervention. So I think with this virtual tutors, training simulators, augmented reality tools, we can also help our colleagues in those low-income countries to upgrade the level and be updated. So this is something which would be published in one of the peer-reviewed papers. I won't give all the conclusion, but what we did is we've developed a software which allows the identification of cancer cells on bone marrows or on crush preparations. And this is based on computer imaging analysis using neural networking. So with that, the primary endpoint was to reduce the variability of the results, to reduce the analysis in time, standardize the information better, and also diminish costs. It's a database of 11,000 images, whereby we've had a trained functional model capable of distinguish cancerous cells. And this algorithm, which we have put in place, will be also applicable to other pathologies for sideroblastic anemias, for example, but we can, expand that to other models. Other project is we've made a memorandum of understanding with ProSfit, which is a big Bulgarian-based manufacturing company for the prosthesis of amputated patients. So basically, because time is a bit lacking, what we do when someone is being amputated, we have to get a prosthetist who would make a mold with plaster and then do the prosthesis, fit in with the patient, and then see if it works out, if it doesn't work out, if he is comfortable or not. The problem with that is probably it's between $20,000 to $35,000. And if you take rehabilitation program, it's $50,000 per patient. So what we've developed with ProSfit, we've developed that, is with an application with artificial intelligence, the patient just does a video, and then with the different algorithm, we have the different size, the different structure, and then we put that into another algorithm which will make different testing with the force plates and so on. And then with a printer HD, we would print out the prosthesis and thereby a reduction in costs. So from $20,000, we've reduced the cost to $2,000. And one of the aims was to empower the soldiers who've been amputated in Ukraine, the diabetic patients in Mauritius, and now we are on the touching line with Toyota Mobility Foundation and the WHO and the Humanitarian for Empowerment and CrossFit to make a global prosthetic so that we can fit more patients. So I'll get over that. It's quite complex, but you know, I'm readily available to discuss if one of you guys is interested in that. But I think this is something which will revolutionize the industry, will not make friends because the competition is, you know, taking from 20,000 to 2,000. So, you know, but that also, it's a policy where we should convince people that it works better, cheaper, and, you know, I believe in that. So my conclusion, because I have 1 more minute, is say that, you know, we need everyone on board. We need you guys on board. Let's work together. We can make things happen. Sometimes we only focus on how much it will cost, but, you know, sometimes it's not the cost price. It's a long-term project. And then I just invite every one of you to take contact with me. We can have a cup of coffee. And these are our partners also who have made some agreements with us. And also it's a win-win solution for the well-being of our people. So I'll conclude with that. This is the place where we are in Switzerland, where the Humanitarian for Empowerment is, where the Pôle Santé Vallée is. So if you are there, it's also the Centre of Haute Horlogerie, where there's Audemars Piguet, Gégère Lecoultre. So you're the most welcome. You have my email. Just drop by. I'd be more happy to have a cup of coffee or a beer with any one of you. Thank you.